Hello, everybody. My name is Tara Tejas. I'm doing my presentation on attention deficit hyperactivity disorder in adults, or ADHD. So, here's my little summary of what my presentation is going to be. My face is in the way, but introduction, brain, adult ADHD, prevalence, and treatment and resources. So, first is introduction. So ADHD, according to the National Institute of Mental Health, is a developmental disorder associated with an ongoing pattern of inattentive hyperactivity and/or impulsivity. The symptoms of ADHD can interfere significantly with an individual's daily activities and relationships. So ADHD was previously included ADD, but now it's just one under one diagnostic label, and it falls under two dimensions of diagnosis. So inattentiveness and or hyperactivity and impulsivity. So people with ADHD can mainly have symptoms of primarily inattentiveness or primarily hyperactivity, impulsivity, or they can have a combination of both. So, inattentive is having difficulty paying attention. Hyperactivity would be having too much energy or moving and talking too much. And impulsivity would be acting without thinking or having difficulty with self control. So, symptoms usually come in early childhood, but typically peak in the middle school or high school. And symptoms definitely or can carry into adulthood. The causes, researchers aren't entirely sure what causes ADHD, but main studies suggest that genetics have a big factor towards it. So inheriting genes from our parents and then also brain function and structure. So in studies have also shown several areas of the brain that might be smaller or imbalance of neurotransmitters or chemical imbalance. And then the third case might be if you're in a risk factor, if you like possibly had any birth defects or any premature injuries or born prematurely. So, in areas of the brain where people with ADHD show a discrepancy in these areas that have executive functioning. So, in 2017, researchers at Radboud University found 5 areas of the brain that appeared smaller in people with ADHD than those without. So these 4 little squares on the side show the prefrontal cortex, the basal ganglia, the limbic system, and the reticular activating system. Each one of those did appear to have an effect for those that did have ADHD. So, National Institute of Mental Health states on their website that research on ADHD has pointed to weaknesses in the prefrontal cortex. They also mention that this is the most highly evolved of the association cortices. So, the association cortices are commonly and also loosely referred to as the cognition part of the brain. Cognition is the ability to attend to external stimuli or internal motivation and to identify the significance of that stimuli and then plan a meaningful response. So when we're that attend is lacking in those that have ADHD. So ADHD in adults is a disorder that begins in childhood and continues into adulthood. Many adults who are diagnosed with ADHD do not know they have the disorder as a child because often teachers or family members don't recognize the symptoms at the young age, or maybe those symptoms were mild, or possibly the individual was able to manage these challenges during childhood. They found a coping mechanism to things that might seem impossible to overcome in other people's situations. So I also provided underneath that is what would happen if an adult came to a healthcare provider now. So they would go into an extensive background on the child's behavior or the individual's behavior as a child and maybe some school experiences. They might also use standard testing or criteria symptoms like checklists that they would use for a child. They would do the same thing as an for an adult. They might also talk to parents or family members, people that can reflect on that individual's behavior. It's also never too late to ever treat or seek treatment or seek diagnosis for ADHD. So it's one of those mental disabilities that remains, I guess, open for because people do have that delayed response to it. So in adults, they must be currently experiencing at least 5 persistent symptoms of inattentiveness or 5 persistent symptoms of hyperactivity or impulsivity, and they must be present in 2 or more settings, meaning home, work, or school, with friends or relatives, or other activities that might interfere with or reduce the quality of social, school, or work functioning. So here are just the list of the signs of inattentiveness. So specifically in adults, obviously we know with kids, it's like they're bouncing on around the walls for school and things like that. But with adults, inattentiveness can be engaging in tasks that require sustained attention, like work or college students that very troubling to sit still in long lectures or even online schooling, being forgetful in daily activities like paying bills, making sure that, the dogs have been fed, you're taking your medication every day, things like that. Signs of hyperactivity might be fidgeting or tapping, squirming in your seat, maybe even bopping a pen here while I'm taking notes or while you're taking notes or something like that. Talking excessively, maybe getting in trouble at work because you're not able to meet your demands such and such. So, challenges that are seen in the adult daily life are still preventing adults from being able to function normally and function easily. And here's the prevalence of ADHD among US adults in the year 2001 and 2003. So, this is the data from the National Comorbidity Survey replication. And it states that the overall prevalence in ADHD and adults with ADHD is 4.4%. And it was higher in males at 5.4, and in the females was at 3.2%. It stated that the estimated lifetime prevalence of ADHD in the US for adults aged 18 to 44 was 8.1%. Approximately one third of children diagnosed with ADHD retain the diagnosis into adulthood. So, treatments and resources adults with ADHD are can use medications, typically stimulants, which can help improve their overall functioning. And then there's also non stimulants. And on the National Institute of Mental Health, they stated that some healthcare providers might prescribe antidepressants to treat with ADHD, but the Food and Drug, the FDA, has not approved these specifically for treating ADHD, but there's also a list of the other ones. Also, other forms of treatment might be cognitive behavioral therapy, and this can help lower their anxiety and help lower their stress, talk through ways to make better habits, overall improve their lifestyles or ways to handle everything that comes with the symptoms of ADHD. There's also life coaching or mentoring, ways to just reach out and be more active in setting goals, new ways to organize yourself and be more productive. That could be in school, that could be in work, it could be for family members, it could be in relationship wise, just finding opportunities that maybe you can participate in classes or coaching or have a mentor or sponsor or some type of person to motivate you. That also falls into family education and therapies. So having people around you that can give you the support that you need to succeed. And this is my last slide on my works cited. So thank you very much.